Joining the webinar today. I'm going to go over hand and wrist health. So the hands typically get, I'm going to pull this down a little bit. The hands typically get neglected even though we use them all day for many various things. The hands and the feet, they contain 50% of all the bones and joints in our body. So, and there's a tremendous amount of real estate, neurological real estate dedicated to the hands in the brain. So the motor and sensory cortex have a huge component a lot of cortex dedicated to them because we grab things, we can read with our hands, we can feel very fine things. So there's a lot of sensation coming in the hands, and if you get a paper cut on the hand, it feels way worse than what it is. So we need to appreciate what our hands do for us by looking after them and not take them for granted. They're more complicated than treating a knee or a shoulder, at least in my opinion. There's physios and therapists dedicated just to treat hands. That's all they do, hands and wrists, because of how many joints are in there and how intricate and how they roll and spin depending on what they do. And the amount of motor units to each individual muscle, they've got a lot more. So for say one band of muscle, you might have like 4 or 5 motor units, so you may have 20 to a small muscle in the hand. But say to like a quad, like the entire quadricep muscles, the big group of them, they might have 2. You know, that's just kind of spitballing. I don't know the exact numbers, but for how many nerves are dedicated to the fine motor and control that we have with our hands, we need to look after them. So just like anything, we want to assess, at least quickly assess, look at the quality of movement that our hands have available to us. So it's going to be more of a demonstration type of little webinar today. So I want everybody to be able to, and we're going to talk about hands and wrists. So if everyone can extend the wrist back, we're looking for anywhere from 80 to 90 degrees. So everybody knows what a right angle or 90 degrees is. We want almost that. If you can get to that, perfect. And we want active. So active versus passive. If you have 80 degrees of active and then 90 passive, that's a pretty good differential. So I'm okay with that. But if you've got 45 degrees of active extension and 90 degrees of passive extension, then there might be there's a big mobility and flexibility imbalance going on in there. So that stuff needs to be addressed, because I tell people when you've got a big mobility versus flexibility difference ratio, say greater than 10%, that's like getting your sports car tuned up and taking the governor off, but not checking the tire pressure or riding it on bald tires. So you're going to have this overproduction of power in the system, but you're not going to be able to hang on, and something is going to spin out of control. So same thing, going down, we want about 80 to 90 degrees of wrist flexion. So it should be extension, flexion, roughly 80 to 90 degrees. If you have that, good, there's no mobility issues, probably not a lot of stuff we need to stretch. Deviation, we want to look at, can we just freely move? It's roughly 40 to 45 this way, anywhere from 20 to 30, depending on what textbook you've got. And dealing with the hands, we also want to look at how they roll. So they supinate, pronate. Okay, can everybody see that there? So keeping your elbows tucked in, can you rotate 90 degrees down? If you're grabbing bars for bench press, really important, can you supinate all the way up and hold a bowl of soup comfortably? If you can't, then we need to address that, because some of that rotation is actually coming from the elbow, but a lot of the muscles that control the hand attach to the elbow. So this is where that connection is important, and we'll come back to that. To see if you have tight hands, now a little test, it's called a Bonnell-Littler test, and we use it in physio to look at arthritis. Is there a joint restriction, or is it more soft tissue? So Bonnell-Littler test, I'll do it with my right hand. Can you extend the wrist fully and flex all the digits down so that they close on top of the pads? If you can do that, great. Now, if you're all the way extension and they stay open, we don't know if it's a tight joint or we don't know if it's a tight tendon. Now, unlock that first knuckle, and if it closes then most likely it's tight tissue, tendons or fascia. If you still unlock these knuckles here and you still can't get them down, then you might have more of a joint restriction. Again, it's an arthritis test to see is it joint or soft tissue restrictions causing hand limit mobility stuff, but you can use it totally functionally as well. All right, so we went over flexion, extension, pronation, supination, pronation, and deviation. The other thing you want to make sure is, can you comfortably do opposition, right? So this is a little bit of fine motor. And again, you're just looking at quality of movement. Can you fully splay the hand? Can you cup? And when I mean cup, can you create like a little tent, right? Cupping and splaying are two things we should be able to do. It's intrinsic strength of the hand. So if you can do a lot of those things, great, okay? If you can't, then I'm going to show you some things that you can do from a soft tissue standpoint, from a joint standpoint, and a mobility and strength standpoint as well, to see if any of those restrictions start to remove out of the way. All right? So one more thing that you can also use to measure, just measurement purposes, is grip. Now at work, we use a hand grip dynamometer where it measures the kilograms of pressure that you can put through the hand. And for all of you who joined into the shoulder health workshop, you know that grip is one of my primary pillars for shoulder health. So the stronger your grip is, the greater potential for strength, and you get that nice irradiation reflex for reflex stabilization. But you don't want a big difference right and left. If there's more than a 10% difference, you've got tires that work well on the right side of your car, but not on the left. So again, you're going to start to spin out. If you're pressing or pushing or doing any kind of gripping, you're going to end up driving that stronger side, potentially cause a problem somewhere through the kinetic chain, and just ignore that weak side. If you don't have a hand grip dynamometer, very simple. You can use a set of grippers that you know you can crush, and this is 150 pounds. And I know these guys I can squeeze pretty comfortably. So I can use this as a little measuring stick to see what my nervous system's like. If I'm struggling after 5 doing this, then I know that my nervous system isn't really primed up, or it just might not be a really heavy day. So we'll get baselines with majority of the athletes that come into our clinic because they're training multiple times a day. We want to measure fatigue. So we'll use grip strength on hand grip dynamometer after the baseline. If they're 75 kilo on a good day, and all of a sudden they come in at 65, and we can't pick that back up with some activation, then it's not going to be a very heavy day. So we're going to lighten the loads and the intensity and the amount of work that they might be doing, because that's their nervous system telling us that they're tanking. So we're digging a little bit of a hole and they need to climb out. So we got to optimize the recovery. Cool? Any questions so far? Hey, Brandon, how's it going, man? Bobby. Hey, Timmy. All right, so let's go down some exercises. Cool. All right. So the first thing that I typically like people to do, if there's a soft tissue restriction, if anyone's used a lacrosse ball or a golf ball on the bottom of their foot to massage the plantar fascia, great. It stimulates receptors. It'll help loosen off the tissues. Do the same thing for your hands. So lacrosse ball in the palms, clasp the fingers, roll it around, and you hold on. You might get a little, no, okay. Might get a little popping in the thumbs that are just depressurizing, okay. But same thing, just work it around, work the entire palm area, and just get blood flow. Unstick that tissue a little bit, get it to relax. You might find some trigger points in and around the thumb here. Typically, these opponents' muscles get a little overabused since we're always using that thumb if we're doing a lot of heavy training or gripping. Work the outer, the hypothenar area over here, okay? And just work that for 3 to 5 minutes, okay? You can even press into it and work back and forth. So I'm working on some wrist extension because that palmar fascia, all those digit tendons, they cross the finger, they cross the palm, they come up and they attach into the forearm. So I can, almost just like your foot, press them so I can stretch and increase shoulder or wrist extension while working the palmar fascia. if any of you had tightness in the tendons, you can just stretch them individually. So just grab onto the tips of the tendons and just press them down and back. Don't worry if you're getting a little pop or a crack there. It's fine. You're not forcing, don't crank into it. But if you get a little pop or stretch, don't worry, you're not gonna get arthritis. There was a study, I can't remember, he won a Nobel Prize for it, but I will find out the name, and I meant to remember it. But anyway, this one researcher, he did a 60-year study on his hands to debunk, to see if cracking his knuckles would cause arthritis. So on his left hand, his one knuckle, he cracked the knuckle every single day for 60 years. And on the right one, didn't do anything. And every year he took x-rays of both hands to see if there's any changes. And after 60 years, the left hand looked exactly like the right hand. So you don't have to worry about that whole, oh, if you crack your knuckles, you're gonna cause arthritis. No. However, when you crack your knuckles and you're constantly mobilizing a joint, you are stretching the capsule and the joint tissue. If you just stretch out tissue and don't create some strength around that, you can start to make it hypermobile, and it can start to alter the mechanics of the joint, which then in turn could potentially cause some arthritis because of abnormal shearing and compression forces. So at the end of the day, as everybody who comes to see me knows, if you're gonna mobilize something, you better add some strength on top of that. So if we're gonna stretch, we have to strengthen, okay? Cool, all right. So coming back into Mr. Lacrosse Ball, if this feels pretty good and you don't find any junk in there, take your lacrosse ball. Now, I'm just gonna pretend my palm is the desk, and I'm going to work around into the forearm flexors, because a lot of the muscles that control my wrist and my hand, they end up in the forearm or attach at the elbow. So you're gonna work around into the forearm. Now, you can massage, that's fine. It's gonna get some fascial restrictions maybe out of the way, it'll help with lymphatics. However, I like, and I prefer that you pin and move, because then you're getting some strength development on the backside and you're getting some soft tissue release on the opposite. So it's almost like a self-active release, but I like to call it pinning and moving. So just look for those bands. I find flexor carpi ulnaris, so the band on the pinky side typically gets a little wound up, so I'll jam it in there and I'll just do some wrist extension on that. And work your way all the way up to the elbow. You might even find some trigger points on the inside of the elbow. So I'm not gonna get into elbow stuff. I've done a video for that, for golfers and tennis elbow, but a lot of junk or a lot of elbow issues comes from an imbalance at the mobility of the wrist. So looking after the elbow, you look after the hand and the wrist, and you look after the shoulder. The elbow, majority of the time, will look after itself, but it does need some love once in a while. All right, so you're gonna pin and move. And sometimes you might need some work done up here. Less likely, because we are constantly gripping and shortening all the tissue on this side. This side typically gets long and weak. So working on this and stretching this, don't stretch this. If your range of motion is full and fine, most likely you're getting triggers up here because they're competing with the tightness on the underside. So it's strengthen this, especially in the short range, and stretch this. All right. So once we've taken care of some trigger points, now you can do some passive stretching. So take that wrist as far as you can go, grab onto those fingers, extend the wrist right back. Okay. Again, less likely we're going to be tight here, so I don't typically stretch this, because if the range of motion is normal or adequate, it's not tight. If you're limited with wrist extension, which is more likely, probably tight. You can stretch that. Don't stretch things that aren't tight. If they feel tight, they're probably weak or deactivated, or they're fighting something else. So find out where it is. All right. Another one, you can just sit at your desk. So these are all things that if you work at a computer all day, these are nice, easy things. You can keep a lacrosse ball at your desk, roll out, stretch, mobilize, all right? So these things can help alleviate some of the carpal tunnel compression that some people may get. Finger wrestling, okay? Very simple. I'm going into wrist extension,